All right, we're recording. I'm going to go ahead and call this meeting to order. With regards to the agenda, we're going to do a little switching around so that we can accommodate Dan. Got called into a last minute breakfast meeting this morning in DC. So we're going to go with new business first, or new business before the unfinished business, since he wanted to be present for the budget discussion and so forth. So can I have a motion to approve the meeting minutes from April?
I move we approve the April 11th minutes.
I'll second.
You, all those in favor say aye.
Aye.
Aye. Meeting minutes are approved. I don't see any public comment online, and there's no one present here in person. So we'll move along to the financial update and business.
Good morning,
Charlie.
everyone. Nice to see you. So to present the March 2025 financial report and then the preliminary April. So to start off with March of 2025, the bank balance is $330,000 below reserve requirements by about $50,000. And we'll see that turn around in April. As far as the financial summary, for the month of March alone, we did have a deficit of almost $96,000. It was a low revenue month. The expenses were about where we expected them to hit for the month of March. Fiscal year to date, I'm just going to hit the highlights there. Revenue, $854,000. We're going to reduce that by salaries and wages of about $998,000. And operating expenses of $278,000 leaves a deficit through March 2025 of $421,000. Some reasons for this: timing of grants, and a small piece is the medical program is a little lower than it was last year. Accounts receivable, $101,000. At this time, we have no amounts from West Virginia Treasury due or any large grants amount due. All of it is the smaller dollar value items. Any questions on March 2025?
Well, there's quite a bit of that receivables over 90.
That is under analysis to see what is actually collectible at this time and what will need to be written off.
Yeah.
Have we instigated a billing collections program yet? I know we've talked about it in previous months, but
Not a collections program yet, ma'am. We are again kind of looking at what is feasible to collect and then what we would have to push off to
bad
collections
debt.
first. Yes, ma'am.
But
Sorry, go ahead, Dr.
I
Reed.
would say there are two parts. One is simply deciding which ones are not collectible.
Mhm.
And then the other is that our active accounts is being sure we're doing everything, that can be done to collect them so that they don't get to this.
Any preliminary estimates as to how much of this is going to have to be written off?
I don't remember right offhand. We did look at that last month.
Yes,
I think last time we said, easily more than 50%.
Yeah, okay.
so essentially that'll come out of our bank balance then, in terms of where it'll hit, or
No.
It's not in our bank balance.
Oh,
it won't.
It's not cash.
So
Okay.
when we write it off, it will show up as an expense line item. So you're gonna have increased expenses. Because you showed it as revenue and.
So it's already hit our balance. Like, I guess what I'm trying to say,
P and L.
it's already hit the P and L.
Yes,
All right.
and that's gonna be probably over a couple of fiscal years.
Recorded as revenue already.
Yes,
So
because we report on the
it
accrual.
becomes an expense,
But then it becomes an expense.
whether or not you make it a capital expense or not. Decision
Won't
on
be
a
in the
case by
bank
case.
is the big thing.
Mhm.
Yeah,
Can't spend it.
So before we do an acceptance of the financials, let's go through April.
All right. April 2025, bank balance almost $501,000. We're in compliance with reserve requirements by over 100,000. As far as the financial summary, so as we all know, we kind of have a cyclical year. So spring is usually really good because it has permits, permit revenue in it, and we also get our fourth quarter allocation from the state of West Virginia. So April revenue, 392,000. We're gonna reduce that by salaries and wages of 88,000 and operating expenses of $11,000. There's a surplus for the month of April of almost $293,000. Fiscal year to date, revenue, about 1.2 million. We're gonna reduce that by salaries and wages of 1 million. And operating expenses of 289,000. Leaves a deficit through April of 2025 of approximately $129,000. Accounts receivable, that did go up due to billing of the permits. So that's $216,000. You can see that 1 to 30 days, that's 122,000. So comparing this to our budget real quick, revenue, we are 7% below what we budgeted. A lot of that's due to grant timing. And salaries and wages were above what was budgeted, about 2%. And operating expenses below by 1%. If we want to compare this to last fiscal year at this time, like I said, our deficit through April is at almost 129,000. Last year at this time, we did have a surplus of almost 46,000. That is, our expenses are 0.1% different than last year. So all this is top line, and a lot of that's grant revenue. It just hasn't come in at the pace we anticipated coming at.
Do we expect it to all come in before the end of the fiscal year?
Yes, ma'am. There was a couple of grants that haven't been paid out yet or billed out for prior to my coming on board, and we subsequently invoiced for them, so
Okay.
they should be coming.
How much is that?
So I have Q1 and Q2 of our QRT grant for this fiscal year, roughly $76,369.75. And then we're still finding out at Q4 of last fiscal year for that same grant, which is actually falls under our fiscal year for this year, which is roughly $53,475 some odd cents.
So it's almost the full surplus or the full deficit,
Understood.
just about right.
Is now.
So we don't need to make any operational changes on to deal with this deficit at this point in time, or do we?
We did have one staff person resign, but in the last few months, we've also brought on new sanitarians. This was on the sanitarian side. So we're not immediately replacing that person, is that we're reassigning duties.
Mhm.
And that's, so operationally, we're gonna see how that works. Keeping our belt tight.
Questions?
No,
Is there a motion to approve March's financials?
I move we approve the March 31st financials.
I'll second. We only have 3 board members present, do we?
We'll have a fourth shortly, but we do have a quorum.
Yeah, we do.
Any discussion? All those in favor say aye. Aye. Any opposed? All right. Okay, thank you, Charlie. All right, we'll move into the agency reports, Brenda.
So the good news is this month, we did have somebody from the state come down to, certify one sanitarian, in food inspections. He's fully cleared. Which is why you've seen this number go up. We were able to complete a total of 66 food inspections in the field this month, which is almost double of last month. Incredible having another person to help out, take some of that burden off. But he's doing a great job. The septic side, we're still continuing to see, I think, the last wave of that trend before these impact fees start to hit. We had a total of 51 well and septic applications this month, which I think was probably a year-long high for us. Given,
Is that for April or, oh yeah, right here.
yes, April. I don't know what month we're in.
Yeah,
Yes,
same.
April. Yes, and Mason is still primarily tasked with well and septic only, and he was able to get 76 permits out in 1 month, which is incredible. He's doing a great job. We did start work on our grant. We did have a resignation this month. It was one of my office assistants who was responsible for the permit renewal process. So that's sending out, processing and issuing the permits for all of our fiscal year permit renewals, which I think is a total of about 400 facilities. So I have, with the help of Krista and some of my sanitarians, been resuming that duty to make sure that our permits are still getting out in a timely manner, that people are getting their permits processed in a timely manner, that their checks are cashed, and they're not being held or anything like that. So that process has been pretty smooth. And then next month, we're looking towards having all of the rest of the sanitarians fully certified. So things are looking pretty good over here. Like that. Questions?
You said all of the sanitarians will be fully certified in both food and well and septic. I
Yes.
thought there were some that didn't quite make it for the training schedule and we
Mhm.
figured we'd have to, so
Yes.
how's that? work
So
out?
the plan is that Brandon Jonathan will be fully certified food and septic. Alyssa will be certified in septic, so she will catch the food part in the fall.
Got it. Any questions?
Do you think you're gonna have to hire an office assistant to make all this work?
I think that we would be able to reassign duties once the permit renewal season is completed. I think that we'd be able to manage with the incoming applications for at least another year, and then we can reassess then.
Oh, really?
And you're using cross-training staff from
Mhm.
the clinical side.
Yes.
So that we're eroding some of the walls.
Yeah, we've been, they have been kind of getting some on-the-job training, some crash course into environmental health, because we do have about 50 total programs that we administer. So all of those have to be, they all have their individual applications and ins and outs that somebody would have to learn. Right now, the sanitarians are the best people to kind of fill that administrative role, because we all know how to permit, the different establishments and what requires a permit and what doesn't. But the administrative, the clerical tasks, the filing and the emailing and correspondence can all be done by somebody from the clinical side, and they've been very gracious to take those tasks on. They're doing a good job.
Any other questions? All right, threat preparedness.
I can kind of roll that in with the administrator, if that's okay.
Yep.
So with our threat preparedness, we are currently in, I think, Q4 of our threat prep fiscal year. We will be working on getting some like drills going on, call down drills, fire drills, the like. With our threat prep, we actually have some upcoming meetings coming up, one in DC next week, and then one in Charleston at the end of May. On top of that, we have applied out for our fiscal year 26 threat prep grant. We'll see how the state likes it or not, and then the last bit of billing for this Q4 will be coming up as well for threat prep grant. On top of that, rolling in kind of the administrative report, I will be going to both the DC and the Charleston. The DC is actually for the CRI city region. Can't remember what the readiness. Yes, thank you, Dr. Reed. Too many initials and acronyms.
6 years.
City readiness initiative. So again, we did have some personnel change. We lost a office assistant. I do want to say caveat with, like I said, huge shout out to our sanitarians and our clinic staff for office assistants that covering down, taking care of, and this is really kind of working out the flow of our health department and kind of what our needs are. So it was unfortunate that it happened, fortunate to have us look at our needs and how we can function. So bright side of everything. I've been trying to work, making partnerships with some regional organizations. Valley Health is one of them. Just had a meeting yesterday with them. It went really well. Working on possibility of regional grants, things of that nature for us. There is a possibility that we may expand our health department here as well. We're working with the county. The Red Cross offices are they're moving out of the offices to a new facility starting in June. That may alleviate some of the condensedness of our office that allows for possibly more patient care, patient flow activities as well. So that's it on my end.
Any questions? All right, then we'll move on to the clinical. Is Lindsay still on? Yep.
Yes, I'm here. Hi, everybody. Yes, so for clinical report, our numbers are looking average, where we expect them to
Can
be.
you speak up a little?
Pardon me?
Can you speak up a little or move closer to the microphone?
We can't hear you.
You know what? I'm just gonna come inside.
Okay. She's just down the hall. She was
Yeah,
monitoring us to see how it works, and so that's one thing she. Good.
I was wondering, I'm like, did we affect her?
Like one of our officers.
Dr. Ree always says quality improvement, quality assurance, so we're double checking, making sure that the Zoom meeting is very accurate for the public and
Mhm.
want to see a part of it, so.
And we're trying to not have the Zoom bombing like happened to the county commission meeting. I mean,
What, what happened?
We were interrupted with a bevy of profanity and pornography. So now what they do is you can still zoom in, but you're muted until the
Somebody.
moderator lets you
Lets you
in.
in.
So it's
meeting was hijacked.
it was, yeah, we were hijacked. I have my suspects,
That's terrible.
but he was sitting in the audience, so it was kind of.
I feel like that happened during COVID early on. I feel somebody got Zoom bombed. I don't remember if it was the county commission or one of the boards, but sort of before we all figured out Zoom and these sort of pitfalls.
Keep learning, relearning the basics.
Well,
Exactly.
of course, the conspiracy theorists out there think that this was all a plot to keep people from commenting at the
Oh.
meetings, which is not true.
So nobody blamed the Russians or the Chinese or anything. I'm joking. I'm just.
Actually, they will blame the
You would
company.
have.
Hey, from Wuhan.
Yeah.
Of a Wuhan lab leak, yeah.
Sorry, Lindsay, go ahead. Before we go further off the rails.
Now that you're here, Lindsay.
Yeah.
Clinical report.
We're making clinical exciting again.
I don't know why you couldn't hear me, but anyway. So I was saying that the numbers we're looking for our patients encounters are pretty standard, what we expect at this time of year. There's nothing out of the ordinary. I did want to mention that we are having a health and wellness, we're attending the health and wellness event at the Ramsey Civic Center next week, May 17th. It's from 10 to 2. And for that, our health department, our QRT team are preparing to be there, providing a lot of info to our community. We recently hired a new peer recovery coach. She will be pulling in 40 hours a week is what we're estimating, so we'll have now 3 people on staff. That, and we've had more and more calls happening, so it's good to have 3 people now who can take on the load. And then for MAT, as Dr. Reedy had mentioned last time, we are approved. We haven't received any patients yet. So I'm gonna be working on some advertising. Plan is to go door to door to clinics and dental clinics and places in the area, healthcare places, and talk to people about that we have at the health department MAT program. And then the last thing I did want to comment on that, we're talking about cross training with all our employees. Jenna, one of our office assistants, we are also trying to get her up to the point where she will be in charge of billing completely. We're trying to take that one particular task and really get one employee really good at it. So that would help with our revenue and being on track of the reimbursements we're supposed to get from insurance companies. Because it's been all on one person's plate who had a lot of hats to wear. So this, projecting for the next year, I'm hoping that will help with accounting for income.
Any questions for Lindsay?
By the way, we could hear you, but it just was so low, we couldn't hear you, we couldn't understand you.
I'll have to look into that. That's one computer was that.
I think it might have been just a proximity to microphone.
So my video was right here, and it's a Logitech. It's
Oh.
supposed to pick up mic in it too, so I don't know what happened.
Well, you don't have a naturally loud booming voice.
Yes, I've been told.
I believe last year we had something where we were getting sound out of those speakers, not just the screen, so we'll have to look at that.
Health officer.
So, several changes in the clinical aspect over the past few months, as family planning program has changed some of its rules. We are expected wherever possible to be billing insurances rather than, that's always been the rule, but it's never been what's been enforced, and many health departments don't bill any insurances. And so there are more and more people when they're coming back to get their interim visits with the nurse. Under the family planning program, because we don't bill a third party, the reimbursement rules can be different. So the nurse would often meet with that patient or client and give their shot or refill the pills without a practitioner or a physician is actually seeing the patient. For third-party billing, they expect this kind of visit to actually have a face-to-face encounter, or nowadays face-to-phone encounter. But there's person-to-person interaction. So when these people come in, I'm seeing them briefly and discussing the issue, making a brief note, and the billings going out in my name. These are small things, but over the course of the year, they do add some workload, but also some billings that will be reimbursed. So in the past, some billings haven't been reimbursed because we haven't met those criteria. As we learn each of these little steps, it's going to make a difference.
And that's an insurance requirement, or it's the insurers that are?
So, right, so the insurers will say, this goes back decades, that said, to build this level of service, you have to provide this. So if your medical assistant sees them, we're not paying you as if a physician saw them, which makes sense. Of course, there's lots of room for gaming of increasing the fees. That's not our goal. It's just to, be able to get reimbursed for the service provided. So those are changes. The, I did go to a meeting in Morgantown Tuesday, which was from the state reportable disease or epidemiology, talking about outbreak reporting, and it was for the northeastern area, so the closest we can get for a regional meeting is 3 hours away. But that's okay. It was a good meeting, met with a number of different staff from the state and other health departments, so it's just kind of good to get with them. Next week, I'm going to the annual Virginia AIDS conference, and that's something I've been involved in on and off for more than 20 years. We are seeing, or I'm aware of more AIDS cases over the past year. Those don't get reported to me, but I hear of them often. And a number of these people are involved with substance use disorders, so injection. Syphilis has been in the rise across the country for several years now, after becoming less involved. The big problem, I mean, syphilis itself is a problem, but the real problem is that the number of pregnant women with active syphilis is increasing also. Pregnant women can pass this on to a child and it can cause birth defects. So this becomes, they've changed the guidelines that a pregnant woman should now be not tested once, but 3 different times during the pregnancy for syphilis. So these are things that we get involved in because we are informed of every syphilis case that get involved in. So it's not a tidal wave, but it's something we have to look at, and they're different entities who end up calling us for advice, even if they end up treating the patient. We're continuing to see some people from Mountaineer Recovery, or actually pyramid system, which is just over the county line near the VA. It's a substance use program, inpatient program. They also have an outpatient, less intense program in Hedgesville at the old Boy Scout Camp Frame. And this was bought about a year ago from Mountaineer Recovery, which was a local startup, and now bought by a multi-state corporation. The number of clients they're serving has greatly increased, and they've been sending us patients with hepatitis C to evaluate and treat, which is good because that's something we wanted to do, and we're going to be having more formal discussions, making this a protocol. They spoke to their administrator the other day, trying to see how we can do this and collaborate also with Berkeley County doing it. The hepatitis C, if untreated, about half the people with hepatitis C end up getting rid of their disease on their own. The other half, it's a long-term problem, and over 20 or 30 years, their liver could start, burning out, getting scarred, cirrhotic. And so some of the people we're seeing have known they've had hepatitis C for over 12 years, and they're only in their 30s. So they won't be old when they get liver failure. If you get advanced liver disease, the only real cure for it's a liver transplant, which is not available for everyone, and it's not like you're just getting your tires changed. It's
You said that half people are dealing with it on their own. What are some of the
half of hepatitis C, the body clears on their own. Hepatitis A, almost everybody clears it. It's never a chronic disease. Hepatitis B, which is worldwide the most common one, and can be transmitted by bodily fluids, including sex. About maybe 90% of people clear that on their own, but another 20% is a lifelong infection. So each one's a little different, but West Virginia has the highest rates of hepatitis C and B and have for many, many years. And that's probably increasing.
And what is C, how is C transmitted?
So D, or
C,
C is transmitted primarily through body fluids. Mostly we're talking blood. And most of the people I'm seeing, of course, now the people I'm seeing are largely referred from a substance use treatment program. But we know that most people who have it, it's from substance use or from unprofessional tattoos. So there are a large number of people who have tattoos done by people they know who are not using it, or within the penal system when they're incarcerated, especially if they're there for a long time. My understanding is you get pretty bored there. And,
What do you think are some of the factors that allow some people to clear hepatitis C on their own? Or
I
not
don't know.
really?
I don't know. So it's so and that would be wonderful to know, because we do not have a vaccine. They've not been able to develop a vaccine for hepatitis C, just like they haven't for HIV. HIV is a chronic disease that we never cure, but people can live decades with proper treatment. Hepatitis C, we now have excellent, easy medicine. It's a couple months of pills that usually have no side effects that cure, and when delivered by a community practitioner, cure about 98% of the people. 15 years ago, it was curing maybe 15% with horrible side effects from the medication. Yeah, so that's a good thing. Lindsay,
Doctor, I have a question.
yes,
And that was, you made a comment that West Virginia, was one of the worst on hepatitis. And is there any particular thing that West Virginians do that brings hepatitis upon them more rapidly than the rest of the country?
we use drugs.
Just the drug use?
Injection drug use is and so there's some people that there's not a clear injection drug use history, but there's drug use history, and but far and away most people that I'm seeing and other people see, they readily admit that they have shared needles, even if it was 15 years ago. Or they say, I've never shared needles, but I know I got it from this tattoo, because they know the person gave it to them, or and though our tattoo parlors or salons, what's the term?
Tattoo studio.
Studio is are inspected and meet standards, but many people don't do that. This is a side gig, and in prison they not allowed to do it, but people make needles from all sorts of things.
And we also do receive and investigate complaints for illegal studios or at-home shops or DIYs. And I have not had to do this here, but previously they have had to issue cease and desists to individuals in our county who were doing those at-home tattoos.
So a concern, and so the medication for this, which is highly effective, still costs for the course of treatment $15,000 to $25,000.
for the treatment, you said?
Treat the pills,
$15,000 to $25,000.
for 90 days of pills, or 60 days. It's down. It used to be 60.
Bargain.
In Egypt, you can get it for 500.
Let's not go down that road.
So that's all I have. Oh, no, one, so we continue to talk with Eastridge Mental Health System, which is the 3-county block grant supported mental health program that's been around for many decades. And they are interested. We have a collaborative agreement with them for referring people to them for psychotherapy or the behavioral therapy part of the treatment. We also have agreed that their clients who need physical examinations, that will do that. And will charge their insurance. And looking at sharing Lindsay's services, because her ability to provide this treatment is a rarity. So we're looking at contracting with them for them to pay us for the hours she can work with them, which defrays our expenses.
Still some logistics to.
That's your specialty, right? Mental.
Mental health, yes,
Mental health.
mental health.
So that is good for her career, because that's what she really wants to do. It's good for us. It brings us closer to that organization, and then we'll defray some of her expense.
Anything else on your report? So we've got Dan with us. Hi, Dan. You know, we can unmute him. I don't think he'll Zoom bomb us.
Morning. Sorry,
Morning.
late.
All right, so with that, we'll go into, is it okay if we do the budget first and then the program? Is that all right? Okay. So let's hop into the budget.
Yes, ma'am. So, with this, new proposed budget for fiscal year 26, we actually are kind of breaking down by the big items real quick.
Hold on 1 second.
Oh, so sorry.
Works the back. I had it earlier. Find it
It's just before the program plan.
right before it. I had it earlier. Okay,
So kind of,
everybody have it? Sorry, I just want to make sure
oh,
everybody
yes, ma'am.
has the
My
document.
apologies.
You've got it, Jack.
Dan, can you see it? Is it popping on the screen?
And
Excellent. So, everybody good? Oh, can't tell I'm a little antsy, right?
It's all right.
Right? I'm actually kind of excited for this. As you see, our state aid revenue actually increased this coming year. The state passed a higher budget of, I think, just shy or at 19 million. So we actually got an increase of about 70,000 for our state aid, which is, I mean, $70 or 70,000, I'll take it. Kind of coming down, we've got nothing in the, from Jefferson County, which we knew. Kind of going through our clinical fees for service. These are the things that we bill out for, whether it be Medicaid, Medicare, however. We're looking roughly 321,780, should be about from last year, similar. Again, hoping that our big busy time is going to be coming up in August, September especially for immunizations, back to school, people, all that fun stuff. Going down to our grants, we do get a little bit of money from our grants, for things like our BCCSP, family planning, immunization grant. I will tell you our immunization grant is going to be cut compared to last year. Because that's where they put, the state of West Virginia put their COVID funds into. So they put the COVID funds nationally. Our budget's going to look approximately from the grant, approximately what we were pre-COVID. So that's about 50% of what we got.
So this number reflects that?
Yes, ma'am. We were
what amount are we losing?
about $25,000, roughly, anywhere between. We don't know for sure yet. They have not put it out yet, but the preliminary information was pre-COVID, which would be about half of what we got.
So what was in our budget for this year was 45,890.
And we couldn't bill out. That's another reasoning for some of our funding from revenue stream for this year. they actually stopped it for Q4. We couldn't bill out, that's 15, was about 15,000.
So 1 quarter of that, we ended up not getting.
So,
So, and I don't know where it ultimately landed, I don't know, Elliot, if you know, with the state legislature on immunization policy, a childhood vaccination policy for schools. Did that, I know there was a huge discussion, I don't know where it landed.
my understanding is they actually, the initial push was to, I think, do away with it. That was,
Well, they were doing religious exemptions and
there's-
exemptions, but and the reason why I'm asking is just making sure that this number here for immunization revenue
yes, ma'am.
is reflective of whatever potential percentage of people may be taking that exemption.
Understood. I do believe it didn't pass through whatever they
Right.
put out, did
It
not
didn't
pass
pass.
through.
It did,
Okay.
no, religious exemptions did not
Yes,
become.
yes.
Okay.
So, there's still the back to school,
So it's still
yes, ma'am,
as,
Yes,
okay,
as
got it,
is.
thank you.
Well, what's the status now of the COVID vaccines? That's not part of the childhood,
That is not, that is an additional,
Option.
It's not a requirement.
it's not a requirement, it is an additional immunization that somebody can purchase if they so do, request it. So.
Sorry, go ahead.
No, yes, ma'am. Looking at our fees for environmental revenue, of course, one of our big areas of revenue. Taking into consideration certain, our growth in the area. So 427,000, 970, which is, I think is a very good estimate.
What does that compare to this year?
Compared to this year, I do believe it's only up by almost the same, but I think it's up maybe 20,000.
So again,
Taking,
considering the macro, because with the impact fees coming in July
yes,
1st,
ma'am.
we know you've had a rush because to try to beat that, but then, I mean, traditionally when the county has done impact fees in the past,
Mhm.
the development
The-
goes down.
Okay,
So I'm a little concerned that if we're up 20% or whatever, $20,000, I'm a little concerned about historical trends in terms of what
Okay.
typically happens
yes, ma'am.
with impact fees.
Understood.
And the fact that it does
The-
suppress
Understood.
development.
Understood. My apologies on that.
Yeah,
Um,
you're like a month on the job. I think is something that we need to,
Yes, ma'am. And that's
Consider.
something we can definitely make an adjustment to
Okay.
that. And if we are going to see a slight drop in development, then we need to.
I think we need to
for that.
account for it.
Yes,
If
ma'am.
we beat it, great, but if we're not,
Good.
especially because it's fee for service, so
Yes,
it's
ma'am.
not.
Yeah, that
Yeah.
makes total sense. Thank you. Our threat prep grant kind of stays the same, 107,620. Our CDC infrastructure grant, should stay the same as well, 92,000. Our QRT grant, that we will completely bill out for is up to 176,000, which is going to be great. On the other donations aspects and some of our smaller grants, we get the Board of Health grant, Board of Education, sorry. About $20,000. We did get a NEHA grant, for our environmental health services. So that's 23,500. We are getting a supplemental avian flu grant. So $8,500, not a whole lot, but it's something. That's going to get geared toward more educational aspects of, because this region does have a lot of folks that have their own little chicken coop farm things. So just
Don't
preparing,
snuggle your chickens,
yes, hey.
snuggle the chickens.
And then also with what Dr. Reedy had brought up, with East Ridge, there is the possibility of a contract there to supplement, Lindsay's time and effort at East Ridge. So that would be a portion of her paycheck coming out there, coming back to us for that. So estimated total revenue, 178, 1,788,448. Our personnel has dropped comparatively to last year. Because one thing that I don't take insurance, so that's something that does not need to be reflected in our budget. I don't take it, we don't pay for it. We did lose that personnel, we don't expect to hire. So, on that case, that's salary savings on that aspect as well. I did up our operational expenditures by about $20,000. That's a typical, loose guesstimate on just increases of products regardless. So it puts us at our total expenditures of $1,650,167.64. That would actually net us a profit of about $108,000
Surplus.
surplus. Sorry, not a profit. My apologies. Wrong word. Turn of phrase. As you can see on the Jenna or Krista, will you scroll up? I will go over this. Yeah, I broke down the pie chart there. It's by actual areas, but on the line graph, you see most of our aid is from either state or grants, and environmental.
Which colors, which?
I'm so sorry. State aid is the, I do believe dark blue there on the left. The bar graph.
That's not in the packet though.
No, unfortunately, it did not print off very well. Printing off Excel spreadsheet sometimes does not go great. It is in the packet that I emailed out to everybody. So you see this, the state aid, which is the far left, is the main majority, covering down between state aid revenue, clinic and grants, clinical grants. The next highest honestly is pretty even environmental and grants in general. That'd be federal grants. Those are two big areas. Our fees for service and our fees for service can be up there, but and the others just kind of that supplemental stuff kind of catching down a little bit comparatively. So it's kind of how we broke it down a little bit. I don't want to have any questions, comments, concerns. I know we have that issue with environmental that I need to take into consideration there and readjust.
How sure can we be of federal grants continuing?
Not.
About as sure as walking on a shaky bridge. Honest to goodness, as best way I can say that. I would love to say that all the craziness is done. And as far as grants being removed or changed.
I'm afraid to break the news to you. The craziness has just started.
And that's an unfortunate aspect of it. We have to go with what we can. I mean, as it stands now, we're still going to receive the threat prep grant. We're still going to receive the CDC infrastructure grant as it stands currently. These are very trying times, especially in the world of public health or in the world of just federal funding. If that is the case, we do lose those grants, we have to obviously adjust and figure out what we're doing. And it's a hard conversation to have at a later date. But it is something that is not far from the tip of my mind, right?
Good, because we can't bury our heads in the sand.
It is always a very pertinent situation that is in the front of my mind about the situation. Coming from my background, it's plan for the worst, hope for the best. I do have a plan for the worst. I hope that we don't ever have to worry about that. So,
Okay. Well, you want to share what that plan might be for the worst?
yes, we will end up losing personnel and having to extremely cut what we do. Okay, so that's the worst case scenario plan. However, our plan currently sits, minus some of the environmental fees that I didn't realize about the impact, is to go with how we know. And what we know right now is that we are still going to be receiving these grants for this fiscal year. With the adjustment, if we're going to take into environmental health adjustment, just off the top of my head here, we'll probably break even roughly, just give or take there. Also giving a little leeway with the fees for service as well. And it's something that we probably should do as well. We'll probably break even then, which we're not for profit. I'm not gonna complain there. As long as we don't run it, I don't ever want to have a budget that I know that we're gonna run a deficit on and, I feel confident that we won't run a deficit, but we are doing a lot of things and starting to work toward doing a lot of things that will help us out in that aspect. So
you've got, I mean, based on this budget right now, you've got about 125,000 wiggle room between expenses and
yes, ma'am.
revenue.
And expenditure, the operating expenses as well, somewhere that we may want to increase too, because we never know how the prices are going to go up with the nature of or the climate that we're in currently. That is an area that is also another shaky area, right? 1 minute a pen could cost us 5 cents, the next day it's 25. If you're buying a bunch of them, that adds up real quick, right? Same way with gauze or syringes, anything. So those sorts of areas, it is a very fluctuating environment with certain things.
Question.
What is actually comprised inside the environmental health other revenue? Last year's budget had 76,000 and we're really showing only 80 bucks. And then this year's number in the budget is 53,000.
So
what is that inside that number?
I know one of them was the NEHA grant that I had separated out because of the situation of being it falls under environmental health. However, I did want to break that out as something that we did receive. The other aspects though,
Did we not get the NEHA grant this year?
We
did, it was reduced.
yes, that's correct. It was
We did not apply for as much, some of the, if you'll let me, some of what we were doing was, being involved in training other health, departments throughout the state. And the person doing that, Robert Custard, was, an employee with us. And, so his salary was a large part of that, but, we decided that, we couldn't keep doing it for, several reasons. The biggest two are that that's outside of our jurisdiction. We have no authority to be training other health departments. That's the state's responsibility. I don't have the ability to oversee that at the time. You don't have the ability. But also we need even if it's only a few hours here and there that our staff's involved or an occasional trip elsewhere, we don't have any of that time. We've got to be serving our community needs. That's what we're for. So we said, this is great. We support the venture. Maybe another health department can take the lead on it. And so Monongalia Health Department's doing it. He is now their employee. But it's just like, this is something we can't manage this, and we need our people doing their role. So we pulled in a little bit. Those numbers, become almost not operational as far as the money's coming in and where it's going and then where it's going to him. So it doesn't show up conveniently on here. And I hope these kinds of monies in the coming year, we can show you in more granular detail what's happening with the money, whether it's, how much we're losing on family planning program or how much we're making, just for example. Couple comments I have on assumptions in doing this is there are all sorts of assumptions, and we have not put down any grants that we don't know of and that we're hoping come to exist. They aren't there. we've put almost nothing in the expectation of making money from treating more people with hepatitis C or medically assisted treatment of opioids. Those are major program expansions for us, and they could be large amounts of patients we're seeing and reimbursements. That does not, it's not really reflected here. So that's one of our ways to operate now. One of the assumptions is that Medicaid, the more indigent people or disabled will continue to be available. That's not a foregone conclusion by any means. So a number of the people we're wanting to serve with both these programs are 100% dependent on Medicaid as their source of medical care. So if that drastically gets cut, there won't be funding for that. So we plan things, but we also could assume that all these grants are coming. And so I could assume they all go or they all stay. Right now, best of our knowledge is these grants, we're going to continue. And the
What
biggest
about
one.
the opioid one, the First Foundation
So-
Reference Club?
Oh,
The
so
one
that
that
one,
Jefferson-
I do not know what's happening with that. Both the county money it's crickets, as they say, and don't hear anything about it. And when the next requests for grant proposals from the First Foundation are, I'll need to look into that and see. There's not clear messaging to the community. There's nothing through the Department of Health as far as how to apply, what's available. The other pieces, whether over the next year, Berkeley County Day Report Center is going to be handling the Jefferson Day Report, which will stop services after the June 30th. And because that's grant supported and county commission didn't realize this other not-for-profit was going to stop offering the services, Berkeley was able to step in and continue to provide the services. Whether we will have a role in that or not, that's in the county commission's hands. Whether we have a role now or a year from now, don't know. So that's a possibility, but that's not anywhere in the budget. So lots of big uncertainties.
I just want to try to not fluff anything up, make it as legitimate as possible, because again, we can't operate on a idea that one way or the other. I did misadjust for the environmental with the impact fees, and it was, I will say that was thought process went the wrong way on that one. But again, this is we already operate on a shoestring budget, and so which is fine. We're a county agency or a state agency, whatever you want to call us, that serves people that need help. I'm not here to rake in the dough, as they say, right? But what we want to do is make sure that we provide the services that we can provide to them, to everybody within the area that we can. One of our hard-hitting areas has been environmental health. We haven't been able to do as much as we can. We will be able to do that soon, which is awesome. Our nursing staff, we are working on, increasing some areas of operation, OB MAT being one of them.
And
Right,
the
besides
budget
C
number
program.
is the same.
So with that,
Yes.
will we have a surplus using those? Maybe. It's hard to say. Depends on if we get one patient or 100 patients. It's what we can do to provide services to people.
Because I remember a couple of years ago,
Card is the same.
it was A couple of years ago, we were advised that we should decrease our estimates of the environmental health need because of inflation and, the builders was saying there's gonna be decreased building and that never happened. Berkeley and Jefferson are outside certainly the state trends and many national trends, so we're gonna be working on being fully staffed as if this doesn't slow down so that we can be getting things permitted rapidly and the, food service industry, inspected as much as necessary.
Yeah, I don't think we need to change any personnel side of it by any stretch. I just want to be realistic as to what potentially, now look, it could not matter because at the end of the day, Loudoun County's kind of full, so we're the next stop. But we have density, density differences, and all of that kind of stuff in our planning and zoning codes, so. I just want to make sure that we're being realistic here.
Totally understand.
And we were just looking at it, so the revenue this year was 314,000
Mhm.
with permits, so you've got 309 here.
Yes.
Which I think is that the same as last year? I'm resisting reading glasses, I'm refusing, it's like it's the last bastion of my youth. So right now you have it budgeted flat year over year. I don't know how others feel about it. I'm okay with that. But just you gotta keep this, your little buffer here, 125, just gotta keep an eye on it.
Yes, ma'am.
Hopefully, we're not 125 below, but on just that, but.
I mean, I put in the Excel spreadsheet to do this plus and minus for me, so.
Yeah. I double checked your math, but.
We're also talking about, giving a more expanded view of this month by month.
Yeah.
Instead of having, let's say, a program that we expect 200,000, that's been showing up in July is 200,000. And then throughout, it's catch up, but there certainly with the permitting for environmental, we know it's not 1/12 every month. And
Right.
So we're going to try and have, this month we expected to get 15,000 and we got 9, okay? But it should be, our monthly reports should be more realistic. We should be able to see for the majority of these programs. Some of them will just straight line up, but the vaccinations, it's higher for flu season. And the trends show that. And so we're going to be really looking at the trends as they have historically been. And each month we'll either get, 1/12 or more likely we'll just be putting in the percent that it was last year so that we can be watching trends as they occur instead of saying, oh, we've got 500,000 in accounts receivable, which, we have not been paying attention to that because so much of it was grant monies that were way behind in coming to us. That's off the table, and where our other other deficiencies in accounts receivable are real clear now, and we're going to keep focusing on that.
Any other questions?
Not for me.
Dan, do you have any questions? You've been.
No, I don't. I think, this is a good budget based upon what we know at the time, which is all we can do. I mean, I think we're going to have to keep an eye on, any number of, like Dr. Reedy just said, any number of programs, month over month, and hope that things stay steady. But I think as presented, I mean, it's just tight, but that's the reality. So I think it's you all have done a nice job here.
Thank you, sir.
Thank you.
Anybody like to entertain a motion or put forward a motion to accept the budget as presented?
I move that we accept the proposed fiscal year 26 budget.
We have a second?
Okay.
Dan seconds, any discussion? All those in favor say aye. Aye.
I,
The budget passed.
Thank you.
Thank you, guys. Thanks for the
Thanks
work
for all
on
your
this.
work. I know that was a lot of work.
Now he's just gonna keep this also all year.
Yeah, you know, just, let me just get some money after this, we'll be all right.
I notice your feet are really wet now.
Well, you know, it happens, happens.
Got rain lately.
Yeah,
Yeah.
that's good.
All right, I think the last thing on our agenda is the program thing. So I can't remember if we talked about this last month or not.
Just briefly, but did
Yeah.
not give you anything in writing, and so, Mr. Caprio, I did send this plan. In a separate, Board of Health email this morning. So, the people here have it, you don't need to show it, because it's,
Okay.
it's gonna be too hard to see.
Yeah.
So what it says the program plan, this previously, before last year, before fiscal year 25, in February, March, the state would send out a program plan for the upcoming fiscal year that we needed to complete. And they had an exact form, and we had to enter it into a computer program. And so some of these forms are duplicating that. A lot of it they had was just routine statistics and data that they wanted for their site, such as home addresses and phone numbers for all the board members and what jurisdiction you live in, and a number of different things. I've tried to remove for most people any of that. That's not really necessary for the program plan. It's data we have. The first page has sort of a table of contents. So the first part's the health department information, and this is just routine information that can continue to change, and I think becomes the basis of a kind of a booklet. Needs to be reformatted in a better way. The Board of Health members, organization chart, staffing. So through page 9, those are just kind of basic stuff that is for your information. It's not, did put down on page 10 and 11, the projected inspections and permits for environmental. That's based pretty much on what it's been this year. Again, with all the questions of assumptions, so we didn't make it look exceptionally rosy. It's kind of interesting to look at stuff with a year total, like the family planning patient encounters. It always looked like we're not doing anything. When you look and say you had 309 encounters, well, that's something. But as you can see down at the bottom, the viral hepatitis and opioid use disorder put in relatively small numbers. So this is not, so in the viral hepatitis, sometimes for treating people for this disease, it's so simple now, even though it costs $15,000 or $20,000. I may only have to see the person one time, examine them, assess them, go over their labs, go over what's needed. The treatment is so well tolerated, most people will not need to see me in between or after. So they may see me one time and get a curative medication and get cured. So that's, we can provide a great service. We won't make much money off of that. So 6 is a small number, but, and maybe charge $220 a visit. The OB mat, because many of these people will be coming back many times, that number is, probably way below what it will be. Biggest part of this is the activities plan. So are there any questions on what's there so far? The biggest part, so I don't want an approval today. I want people to be able to look at this. There's no urgency in getting approval, but I want this to be actually a real document that people understand what we're doing here.
What are home loan evaluations? That never,
Home loan evaluations.
That is a service that we provide to people that are selling their homes to a potential buyer to get a approval letter from us that their septic and well is safe and functional.
oh, okay. So right now, so for existing home sales. Okay. What's our role with regard to all the new construction? Is there any services that we have to do? We have to inspect every one of them?
For people that are going through the Jefferson County Office of Planning and Building and Zoning, they refer a lot of clients to us for all demolition permits that are on a site that contains a well or septic. So they want to tear down a structure that is connected to a well or septic. We have to make sure that they're doing that in a way that doesn't impact the actual septic system or well. So we do see a good bit of those, as well as anybody that is planning to do modifications on their home or planning on adding on to their home. They also refer them to us to make sure that that would be acceptable through the sanitary code.
But as the wave of construction that's happened in Jefferson County, has that increased the workload?
Yeah, actually, I noticed this month that we had done a total of 10 of those this month, which I think is they're trying to get those business or those planning permits.
That sounds low, because there's been hundreds of, maybe a lot of these are not on well and septic, is that?
Yeah.
No, okay.
So a lot of developments happening inside cities and we don't have jurisdiction
Right.
for those, right?
Okay.
Or inside the municipalities, cities probably a little bit of a stretch.
And in Monongalia County, there's development, but a lot of those people have access to public sewer and water, is that correct?
I'd say about 90% have access to public water. Public sewer is available in the city limits of Morgantown. Outside of that, it's almost exclusively private sewer systems that the health department permits.
But not individual homeowner systems.
Yes, individual homeowner systems. So there are 2 treatment plants that I know of that service like a manufactured home community. So maybe 20 homes on one parcel of land.
So every county is different. So on page 12, start with activities and talk about just, I know you can't, I don't expect you to read it all here, but I'd like this to show what our needs are, and there's some things that we have to do because it's in the statute, and I've quoted the statute throughout this, just so you can see what it says. So these are things that are required, and then there are others that we may do. So there's the shall and the may. So the shall and almost everything in environmental is under the shall. There are fewer things under the clinical, as far as how we do things here, I really like our management to be, not just management, but our way of doing things to be with a quality improvement approach, is that it's not just, we've always done it this way, which is something we hear too much, is that keep wanting to improve things and really get down to what is it we're improving, why. As an example, we're scanning environmental records. That's something that's an issue that's not required by the state, but it's one of the things we do. We're trying to scan them into a digital version. Well, it's 6 years ago since that company was selected, and there were other people in planning and zoning and others who were wanting us to sync with the county system. That's not really been relooked at with those partners to say, did our paths diverge? Are we still on the same path? So all those things, why is it we're doing this? Are we meeting it? Is it meeting anybody's needs? How far are we going? We've not made great progress until the last 2 years. We've actually gotten a lot more records in, but the the original assumptions, all the people who were involved in those assumptions at this end aren't here anymore. So we need to relook at this from a, why are we doing this standpoint? And
Are we digitizing new documents at least? So
Yeah.
we're not like still reverting back to paper so that it just adds to the, okay.
Correct.
and we can, and that can be, so another piece, I want this to be a document we look at as kind of a blueprint. The contractors look at their blueprints all the time, is that we look at this with each meeting and we do some aspects of this, we report on it. So that would be one aspect you can report on this, and maybe give a presentation. The other quality issue is that I'd like to see that there are two quality measures. One is, are we certified by a national organization? And state health departments and local health departments can be accredited, meaning they've met certain standards. Simple things like, did you check when you hire a physician that they actually did graduate from medical school and are licensed? Or, I mean, there are a lot of like, do you have emergency medications? Yes. Do you know how to use them? Yes. Did you prove it? Yes. So all these things that you say, well, this is silly, but then you look at it and you say, well, I hope my doctor does that. So so there are accreditations. It's a long process to do, and to actually go through the accreditation becomes a lot of bureaucracy, but meeting their standards and doing it, I think, is a different thing. 40 of the 50 state health departments are accredited. West Virginia is one of the 10 that's not. Of the 48 local health departments in this state, so some health departments are combined, that's why there aren't, the same numbers there are counties. Of the 48, two, Cabell Huntington and Kanawha Charleston are accredited. None of the rest of us are.
Who does the accreditation?
Excuse me?
Who does the accrediting?
So this is, it's called the Public Health Accreditation Board.
Is that
not
federal?
It's not a CDC thing, I do not believe. So it's just like Joint Commission does it for hospitals. And there can be other organizations that do it, but that's the predominant one. But it's to participate with Medicare, you have to be accredited by a national quality organization. And so this is not a requirement.
Is this an NGO or is it a federal agency? What?
So this is so I actually cannot say for sure. I know that the Joint Commission, it's been around for decades. That's a non-governmental organization. It's a private organization that contracts.
And why wouldn't we be accredited?
Because we haven't met the standards. And we can have,
Standards.
This is an NGO.
excuse me,
This is an NGO.
okay, yeah, so it would be nice to be accredited, but not so much to have that sticker on the window. So when I was at Shenandoah Community Health, we were accredited by Joint Commission. We were 2 ambulatory care sites in the state. It's a lot of work. You feel good when you get accredited. It brings us $0 for doing it. It costs us money.
Right.
So it's, so meeting the standards, I think is a goal or a benchmark to use. But actually getting a grant to get it, that I think could pull us away from our mission, which is delivering the service. So
Well, that's fine. Yeah, I'm just curious.
yeah, so it's a big question, and it becomes when you read through what they require, you say, well, yeah, that's a good idea, but then having the paperwork to show you've done it becomes a lot. And so that's so just I'll go briefly through some of the items that are so from an administration standpoint, we have here I break us into 4 departments: the administrative and financial, the clinical, environmental, and threat preparedness. So the administrative, we're required to have an audit And our last one was fiscal year 23. Our one for last year was not done, and that is currently being contracted.
Yes, sir. We have a contract put out. We were waiting for the timeline from the CPA facility to give us the date that they'll come in and do that.
So that should be done this spring. We're behind on that. But this same firm is contracted to do the fiscal year 25 one. So that this October they should do that, and hopefully by November, we have both received both reports. Next January, we will get the announcement from the state to do the for setting the 26 one. So that's on
Yes.
his schedule. It's not going to fall behind. We've had clean reports for a number of years. The environmental services fees, that's just something we're required to have, and that's now through the Board of Health and the County Commission. Clinical service fees, we can set our fees. That's one of the may. We can provide services, we may do that. Big issue is we need to be sure we're doing it in a way that meets the industry requirements, and that we're collecting the monies, and that we have better knowledge of what we're billing, what we should be billing, whether we're getting the money. And so we've talked with two of our staff about getting more formal training through Blue Ridge or others to become certified billers. Also discussion with outside agencies about taking over for the bad debt, looking at the possibility of them saying, well, it's 40,000 of bad debt, let them analyze it and get it done. Another piece is looking at, so we are required, it's kind of buried in the law, but we are required to treat people regardless of ability to pay, which that's fine as long as people have to be employed by us with that, regardless of our ability to pay them. It doesn't work. So we need to have a sliding fee program and we do have that for family planning program and breast and cervical cancer screening program. But for other people that come in for services, we offer at least our staff time billing. We can defray that cost because we're already paying that. But for things we have to buy, such as vaccines or lab tests, medications, we don't have the capacity to do that. So, but a program for that, that's something we'll develop over the year. And that obviously would require board approval. The facility, so the big plan is to, a year from now, be moving into the new county facility. Our real planning on that starts after the purchase is completed. And the county will be taking the lead on developing that space. We'll need to have our own internal discussions of how many exam rooms do we need, where do we sit, and how many people have their own kitchen and their own bathroom. And just all those little things that are the information to go ahead.
Not to interrupt, but we're coming up on 90 minutes in about 5 minutes.
I'll do this quick.
Okay.
So information technology, big issue. And one of the things is when we're in the county building, we may be switching from the state information technology support to the county. That's just something that's in the plan.
What's the timeline on that?
As far as the move,
The
ma'am,
county, yeah.
Build,
so
you're buying it this month or next month or? You can't say. That's
Well, yesterday we did decide on an interest rate. So that was what the big meeting, that 5-minute meeting was, is just an interest rate. We got a good interest rate. And, but the shift of everything, move in, everybody's hoping for this year, but there's a lot of remodeling that needs to be done. So I'm guessing next year.
So roughly 12 months, maybe.
Yeah.
I'd say a realistic timeline is at best this time next year, we move in, at worst 18 months. Realistic.
That's realistic.
Yes, sir. I mean, with the amount of,
I'm just like you, I'm hoping for the best, but expecting the worst.
yep, got a plan for it.
So one thing that may shift us moving, not as the last agency to move in, is that with the people with substance use disorder now getting treated through Berkeley County as of fiscal year 27, so July of next year. The plan is to have them covered by Jefferson County. The parole board will be in the space adjacent to us from the original plans, and there's some discussion about some of the treatment of them being in the spaces assigned to us, so that may, because of that grants time frame, it may mean that we're not going to be October of next year, that we may be wanting moving us in sooner. Whether that space is utilized by us or some of the service. So human resources also like to, and so you're going to be talking with more with the administrator and their human resources person at the county about having our human resources management being the county rather than the division of personnel. So I've got the code that allows us to do that in here. I won't go through the rest since you can all read it, but there are a bunch of required services. Community health promotion is something we have not done, and actually I think in last year's budget, the monies for the health promotion were cut way back, but that's something we need to focus on, and we're not doing that as well, whether it's website or social media or planned modules. So that's so I won't go through that.
All right, well, I guess do a vote on that next month.
Yeah.
Or acknowledgement next month.
Right, and if anybody has thoughts as they read it, things that just are worded really bad, and I know I'll get feedback from staff here, or things that it doesn't look right, or there's something we forgot to improve that's, things should be mentioned. So,
Right, any other questions? Anything? All right, well, I think that brings us to the end of our agenda. Is there a motion to adjourn?
Before you do, I
Oh.
just want you to know that I won't be here next month, which would have been my last meeting. I'm gonna try to dial in virtually if it's something in Nashville.
Okay, all right. Thank you. You got the important vote today, so. Is there a motion? Would you like to motion to adjourn? This is
So moved.
All right.
Second.
All right, hopefully no discussion. All those in favor say aye. Aye.
Aye.
All right, the meeting is adjourned. Thanks, everybody.
We'll see you, Dan.
Thanks, everybody.
Thank you, sir. Thank you.